So our dashboard has a couple of graphs. They're probably quite familiar. They've been around for a very long time. The first shows the currently hospitalized and currently in ICU numbers. It's a combination of people who are admitted with COVID-specific illness. So COVID has been a part of the reason for them going into hospital, and also people who are admitted for other reasons but have a recent diagnosis of COVID. And we know that that second group still has impacts on the healthcare system with respect to infection control protocols and other things. And we have continuously reported these combined categories. The second graph that you will be familiar with is the new hospitalization rate. So this shows the 7-day average of new hospitalizations. Again, this is combined with those who are admitted for a COVID primary or secondary treatment reason, and also those who are admitted with a recent COVID diagnosis, but are admitted for some other reason. Now, looking at the update of what we're moving towards, we will continue to report exactly the same graphs that I just showed you, both the current in-hospital, ICU and non-ICU numbers, with exactly the same methodology for both new rates and the currently hospitalized, so that there still can be comparison over time with the same methodology. What we're adding to the dashboard is another graph just underneath each of those previous ones that shows you the numbers of people currently in hospital, in ICU and non-ICU, who are there because COVID has directly or indirectly caused their admission. We will be removing the vaccine outcomes tab, and we will be moving to a summary of available evidence. So this is just one part of that summary. We're going to be giving people access to a list of peer-reviewed publications that demonstrate the effectiveness, the best current evidence on effectiveness of vaccine overall, because this, of course, is the most rigorously reviewed evidence. In addition, what we know about our own Alberta data that we've been showcasing on that previous vaccine outcomes tab, first of all, is that since Omicron became the dominant variant, that vaccine outcomes tab has actually been an underestimate of vaccine effectiveness, because it is an automatically generated analysis that uses all people who end up in hospital, whether or not their hospitalization is due to COVID-19. And so the data that you see on that, actually, even though it shows protection, I'll just go back to the slide that I had previously to show you how the vaccine, especially in the older age groups, you're seeing that significantly higher rate of hospitalization in those who are not vaccinated or who have fewer doses. And despite that, vaccination effectiveness is actually even higher than this shows. So this is showing that underestimate, because this is showing all hospitalizations, not just those that are hospitalized for COVID treatment.